Introduction to Electrocardiography, written by Dr. Dale Dubin in Rapid Interpretation of EKGs. The electrocardiogram, or ECG, is a fundamental tool in cardiology. By placing electrodes on the skin, we can capture the electrical impulses that govern your heartbeat. This information is then displayed as a series of waves and complexes on a screen or printout. Understanding the ECG is crucial for diagnosing and managing a wide range of heart conditions. Imagine the heart as a powerful pump, rhythmically contracting and relaxing to circulate blood throughout your body. The ECG acts like a microphone, capturing and amplifying these faint electrical whispers. Through this amplification, cardiologists gain valuable insights into the heart's rhythm, the size and function of its chambers, and the presence of any damage or abnormalities. It is a painless, non-invasive procedure, readily available in most healthcare settings. From routine checkups to emergency room diagnoses, the ECG plays a pivotal role in identifying and monitoring a myriad of heart conditions. Its simplicity belies its profound clinical significance, making it an indispensable tool in the field of cardiology. The heart's electrical system is responsible for generating the impulses that make the heart beat. This system includes the sinoatrial node, the atrioventricular node, the bundle of His, and the Purkinje fibers. Each heartbeat starts with an electrical signal from the SA node, the heart's natural pacemaker. This signal travels through the atria, causing them to contract and push blood into the ventricles. The signal then reaches the AV node, where it is briefly delayed. This delay allows the ventricles time to fill with blood before they contract. From the AV node, the signal travels down the bundle of His, which divides into the right and left bundle branches. These branches carry the signal to the Purkinje fibers, which spread throughout the ventricles. The Purkinje fibers stimulate the ventricles to contract, pushing blood out to the lungs and the rest of the body. The ECG captures these electrical events, allowing doctors to assess the heart's function. Deciphering the waves. A look at a normal ECG. A normal ECG tracing consists of repeating patterns of waves and complexes. These represent the different stages of the electrical activity during a single heartbeat. The P wave represents the depolarization of the atria, the electrical activation that causes the atria to contract. Following the P wave is the PR segment, which reflects the brief pause at the AV node as the electrical signal is conducted from the atria to the ventricles. The QRS complex follows the PR segment and represents the depolarization of the ventricles. The T wave follows, signifying the repolarization of the ventricles as they relax. Understanding the meaning of each wave and segment on the ECG is crucial for accurate interpretation. Heart rate and rhythm. What's normal and what's not? An ECG provides valuable information about the heart rate and rhythm. The heart rate, measured in beats per minute, can be easily determined from the ECG by measuring the distance between two consecutive R waves. A normal resting heart rate for adults typically ranges between 60 and 100 beats per minute. A heart rate below 60 beats per minute is considered bradycardia, while a heart rate above 100 beats per minute is tachycardia. The rhythm of the heart, whether regular or irregular, is also readily apparent on the ECG. A normal heart rhythm, known as normal sinus rhythm, is characterized by regularly spaced P waves, each followed by a QRS complex. The ECG plays a critical role in identifying and characterizing arrhythmias, guiding appropriate treatment decisions. When the heart grows too big. Atrial and ventricular hypertrophy. The ECG can also provide clues about the size and structure of the heart chambers. When the heart has to work harder than normal to pump blood, such as in the case of high blood pressure or valve disease, the heart muscle can thicken or enlarge. This enlargement, known as hypertrophy, can affect the atria or the ventricles and is often reflected in specific changes on the ECG. Atrial enlargement, particularly left atrial enlargement, is commonly associated with conditions like hypertension and mitral valve disease. Ventricular hypertrophy, particularly left ventricular hypertrophy, is frequently seen in patients with long-standing hypertension. While the ECG can provide valuable clues about chamber enlargement, it is important to note that it is not a perfect tool for diagnosing these conditions. Early detection and treatment of underlying conditions that contribute to heart chamber enlargement are crucial to prevent heart failure and other complications. Blocked signals. Understanding bundle branch blocks. The electrical signals that control your heartbeat travel through specialized pathways within the heart. When these pathways are blocked or delayed, the heart's rhythm can be disrupted. One such disruption is known as a bundle branch block, which occurs when the electrical signal is slowed or completely blocked as it travels down the bundle branches. Bundle branch blocks are classified as right bundle branch block or left bundle branch block, depending on which branch is affected. On the ECG, bundle branch blocks are characterized by a widened QRS complex. While some bundle branch blocks are benign and do not require treatment, others may indicate underlying heart disease. The ECG, in conjunction with other diagnostic tests, helps cardiologists determine the cause and significance of bundle branch blocks. Starved for oxygen ischemia and infarction on the ECG. The heart muscle requires a constant supply of oxygen-rich blood to function properly. When the blood flow to the heart muscle is reduced or completely blocked, it can lead to ischemia, a condition where the heart muscle is starved of oxygen. If ischemia is prolonged and severe, it can result in myocardial infarction, commonly known as a heart attack, where a portion of the heart muscle dies. The ECG plays a crucial role in diagnosing ischemia and infarction. Ischemia typically manifests as ST segment depression or T-wave inversion on the ECG. In the case of myocardial infarction, ST segment elevation is often seen, indicating significant damage to the heart muscle. Prompt recognition and treatment of these conditions are essential to minimize heart muscle damage and improve patient outcomes. The heart attack, ECG, STEMI, NSTEMI, and pathological Q waves. Heart attacks are classified into different types based on the ECG findings and the presence or absence of certain blood markers. A ST elevation myocardial infarction, or STEMI, is characterized by ST segment elevation on the ECG, indicating a complete blockage of a major coronary artery. A non-ST elevation myocardial infarction, or NSTEMI, is characterized by ST segment depression or T-wave inversion on the ECG, suggesting a partial or temporary blockage of a coronary artery. While NSTEMIs are generally less severe than STEMIs, they still represent a significant heart attack and require prompt medical attention. In addition to ST segment changes, pathological Q waves may also be seen on the ECG after a heart attack. The ECG, by identifying these specific patterns, helps differentiate between the different types of heart attacks, guiding treatment and prognosis. Arrhythmias, the irregular heartbeat. Arrhythmias, or irregular heartbeats, are a common occurrence and can range in severity from benign to life-threatening. They arise from disturbances in the heart's electrical conduction system, leading to abnormal heart rates or rhythms. The ECG is an indispensable tool for diagnosing and characterizing arrhythmias, providing critical information about the underlying electrical abnormalities. There are numerous types of arrhythmias, each with its unique ECG pattern. The ECG allows cardiologists to identify the type of arrhythmia, assess its severity, and determine the appropriate treatment strategy. Beyond the heart, how other factors impact the ECG. While the ECG primarily reflects the electrical activity of the heart, it can also be affected by factors outside the heart itself. Electrolyte imbalances, particularly abnormalities in potassium, calcium, and magnesium levels, can significantly alter the ECG waveform. Medications, both prescription and over-the-counter, can also influence the ECG. Some medications, such as certain antidepressants and antipsychotics, are known to prolong the QT interval on the ECG, increasing the risk of a potentially fatal arrhythmia called torsades de pointe. Other medications, such as digoxin, used to treat heart failure, can cause specific ECG changes that require close monitoring. Recognizing these extracardiac influences on the ECG is crucial for accurate interpretation and appropriate management. The enduring importance of electrocardiography. The electrocardiogram, or ECG, remains a cornerstone of cardiovascular diagnostics. Its ability to non-invasively capture and display the heart's electrical activity provides invaluable insights into a wide spectrum of cardiac conditions. From detecting arrhythmias and conduction blocks to diagnosing heart attacks and assessing chamber enlargement, the ECG plays a pivotal role in patient care. Its simplicity and widespread availability make it an indispensable tool for both routine checkups and emergency situations. The ability to quickly and accurately interpret ECG findings can be life-saving, enabling timely interventions and improving patient outcomes. Despite advancements, the fundamental principles of electrocardiography remain unchanged. Understanding the basic components of the ECG, recognizing normal and abnormal patterns,